We know some kids, even some grown-ups, can be really nervous about needles. And with 28 million children ages 5 through 11 now eligible for COVID-19 shots, lots of parents may be dreading the vaccine appointment. So what can you do to help make the process easier for your child? Fox Medical Team's Beth Galvin joins us live to talk about this. Good morning, Beth. A lot of parents just turned to the TV right now.
And good morning to you, Leslie. Yeah, I think this is an issue. You know that your child needs the vaccine, and it's a one step, towards getting back to a more normal existence for them. But it's also a hard little moment to have to go into the doctor's office or go to that shot drive and get the actual vaccine itself.
Yeah, Beth. And so what exactly is the best game plan for parents here? Should you tell them before and then potentially have them dread going? Should you just wait until you're in the car?
Yeah, a lot of parents might think that it's, going to be easier to leave it to the last minute and then just kind of rip the Band-Aid off, so to speak, and get them vaccinated. But I talked to Dr. Amy Baxter, who's an ER physician who invented Buzzy, which is the shot pain relief device that's shaped like a bee that some pediatricians use. And she said she really feels like it's important to tell the child ahead of time, to give them a sense of control, to kind of talk about why they're getting the vaccine, at a language that they can understand, and that you feel good about this as a parent, and you want this for them.
Yeah, absolutely. You talked about the Buzzy. I didn't even know that existed. I need one of those.
Yeah, so that you have a lot of options, Leslie, if for shot pain relief. And that's one of the things that you really need to talk to your child about, is have a little plan about how do you want things to go? Which arm do you want to get the shot in? What should we use to lessen the pain? What would you like to do afterwards, sort of as a reward? Those kind of questions to give the child a plan and a sense of control. And when we talk about, pain relief, you've got options like you can put on a numbing cream on the child's arm in the injection site area about 30 minutes beforehand. You could use a freezing type spray that you can use right beforehand. Buzzy is a little V-shaped device that attaches to the arm, and it's got cold and vibration, and it kind of disrupts the pain signal to the brain. And that can really work. And there are other options like that. Distraction can be a really helpful thing. So there are lots of things to get you through that process. The one really good news, Leslie, is these needles are very small. They're much smaller than the needles that adults are getting, which are actually quite small too. And the dosage is smaller. So it's going to be, hopefully not too much of a pinch and not too uncomfortable of a process for the child.
Yeah, I like the game plan. I hadn't even thought about a numbing cream. That's a great idea. And distraction. I think that's what I go for. I just look the other way, wiggle my toes or something.
Yeah, and I think, just important to, with distraction, have something that's really going to draw the child's attention away from the process, from the needle. So something like having them count something on the wall across the room is a good option, especially for a younger child.
Yeah, absolutely. Everyone getting those needles now. We appreciate your time this morning, Beth. Thank you so much for the tips.
Thank you, Leslie.